Hi, Emily here from Pelvic Wisdom Physical Therapy. I wanted to give you my take on scar massage, especially after C-section. So that's what we'll be focusing on today in that area, but you can use this technique for any scars you have in any part of your body. So this one specifically over the uterus and the bladder to help that mobility, but try it anywhere. So first technique, you're gonna find the scar and you're gonna put your fingers on the scar, kind of like piano keys is how I think about it. And you're gonna try to push down on each spot and see and kind of find where the restriction is specifically for you, because everyone's different. So let me show you how I do it with my marker drawn C-section scar. So there's my fake scar, but so all my fingers would be on the scar, the whole width, or you can do it in sections. And I try to push down one by one and find where it's a little bit, if it feels kind of knobby and tight, or if it feels like one finger, one piano key is kind of stuck. That's going to tell us that's really a part we need to hone on and focus on. So there you would just gently push in. You're sinking in, right? Like in towards your bladder area, essentially. So you're just gently pushing in. I would do these all laying down. Unfortunately, I have to stand to show you, but laying down, you're not gonna have that tension of your abdomen. So keeping your abdomen soft, how far can you sink in? And I'm thinking, okay, skin, then we have fascia, then we have muscle, then we have like ligaments and bladder and all these things. So we're seeing if we can gently invite our tissue to kind of come down and can I get to those different layers? So try that. I would hold it for 2 to 3 minutes or until that scar kind of feels like it gives in. And this might take work over a few weeks, but give that one a try. The next one is little circles. So I like to be on the scar or near it. If it's too hard doing or hurts doing direct pressure, do little circles around it. And you're just seeing, can I move? Like for me, I'm a little tight when I pull. Like I can almost feel there's a connection. So then I would kind of hold that stretch, or I would continue little circles while I'm laying down and see if I can get more movement. So we have the sink in, we have the little circles, and then another one I really like to do, I have one hand go underneath and another hand come above and kind of stretch the scar. None of these feel fantastic. I don't want to cause pain, but I want to cause this kind of like stretching feeling of the skin. So that's normal. So one hand underneath the scar, I think you can see it there. And then this hand just kind of pulls up, pulls up, pulls up. This hand can even pull down a little and get some stretch. If you have a partner help you, they can help you with all of these as long as you can relax into it. They can use kind of both thumbs and pull apart. It's a little harder to do on yourself that way. But give that a try and see if you can get that stretchy feeling and see if it makes a difference over the next couple weeks. The last one I wanted to give you is not particular for a C-section, but it's that whole area. If you feel kind of tight or someone's told you your muscles are tight there or your fascia is tight, you're gonna take a flat hand anywhere on this lower abdomen, even into the rib cage, that area works too, but you're gonna see if you kind of just pull the skin. And I'm not pushing in, I'm just gliding the skin. Like I would glide my shirt, like which way can it glide and which way does it not want to glide? So typically for myself, I've even done this in the car, but usually I'm laying down and this one hand is a little bit, it gets warm. So it almost gets like a little bit of traction. We don't want to do this with lotion or oil. That's just going to like slip off. We want to grip the skin a little bit with the heat of our hand. And you're just gently pulling up, getting a stretch. Really check in. How about pulling away from the hips? Is it tight there? And then you're holding it and waiting. Sometimes I'll go towards the area and slack it first if I feel like it just won't release. And I wait a minute or two. And then when it starts to give, I'm like, okay, ooh, I can go this way a little bit more. And then I hold it this way. And sometimes if I'm feeling extra, I'll go to level 3 is how I think of it and pull apart. As long as you can tolerate that. So anything in this area, especially pulling in from the hips and pulling up from the pubic bone. Another common spot to do this is pulling down from the ribs and over. Anything to help loosen up this tissue. So try it on your own or try it with a partner. You're trying to pull the skin and get that fascia, that underlying connective tissue to loosen up. But all of these techniques are great postpartum, especially with C-section. They cut into these tissues and they need some attention. So, and it doesn't matter how many years they've been there. So give it a try. Let me know if you have questions, and happy fascial stretching and scar stretching. Bye.